everyone. Welcome back to the Self-Confidence Chronicles. And if you're new here, welcome. I'm Dr. Christy, and I make videos about self-care, self-confidence, the occasional lifestyle video, and also mental health video. So welcome. I hope you'll consider sticking around and subscribing. Today we are going to be talking about what is borderline personality. Borderline personality is actually something that I get a lot of questions about in my practice. Part of my purpose in having these types of videos where we talk about different mental health disorders is to be able to learn about it a little bit more, provide more education to everyone, and also just work on ending the stigma of mental health and mental health illness, and just making it okay for people to go and get treatment if they need it. There's nothing wrong with getting treatment. I just want you to know that anybody who's struggling with a mental health issue, that there is help out there for you. So today we're going to be talking about borderline personality, or sometimes it's referred to as BPD. But what is a personality disorder? A personality disorder is something that is a diagnosis that is not given until somebody is at least an adult. So you have to be 18 years old to receive a diagnosis of any personality disorder. Personality disorders really are enduring patterns of behavior that are different or outside of social norms of that individual's culture. And they include things such as the way that someone interprets themselves. It includes their mood, sometimes some unstable mood, and it affects relationships, and it also affects impulse control. With personality disorders, these are enduring patterns that are typically inflexible and usually pervasive across a whole spectrum. So one thing I do want to point out with personality disorders is we all, to a certain degree, meet little bits of criteria here and there. And as we go through explaining personality disorders, you'll see that there are probably situations where you maybe acted similarly. However, does that mean that you have that diagnosis? Not necessarily. For someone to receive a diagnosis with a personality disorder, it does have to be something that is considered pervasive over a long period of time, and these behaviors and interactions are something that has occurred in maybe all facets of their life. So let's talk about borderline personality and what are some of the criteria that you must have to have a diagnosis of this. So with borderline personality, it includes a long history of unstable and sometimes volatile relationships, unstable sense of self and self-image, and impulsive behavior in a variety of different contexts. So this is a behavior that you will see in all areas of their functioning. So I want to talk about what are some of the specific criteria that someone needs to have to fit this diagnosis of borderline personality. The first one is significant impairments in their personality function, as evidenced by sometimes an unstable identity and a lack of sense of self. And so sometimes people will say things like they don't understand who they are, they're not sure who they are. Sometimes that can be associated with excessive amounts of dependency or codependency on other people, and like a complete loss of their own autonomy. So when they meet someone new, maybe they'll take on all of the interest of that person and kind of develop that and incorporate that into who they are. But it's not necessarily correct because it's that other person. Another aspect, another part of this criteria is intense feelings of depression. So frequently feeling down, depressed, hopeless, and difficulty recovering from these moods, pessimistic about the future. People will also have excessive amounts of shame, feelings of inferiority, very low self-worth. Clinicians will sometimes refer to this as a labile mood. Mood lability means that someone's mood changes very quickly and rapidly. So they could change from being very happy and content to angry or sad at the drop of a hat, 0 to 60, and it just changes. So someone might experience all of those feelings all in one day. Happy, sad, depressed, angry, all in a period of an hour. And that's what we refer to as a labile mood. It's also very common for individuals who meet criteria for borderline personality to have thoughts of suicide, frequent thoughts of suicide. Usually it's without a plan, and there are more ideations and thoughts of without an actual follow-through. Another criteria for borderline personality is impulsive behavior and risk-taking behavior. So someone who meets this criteria will also have a long history of impulsive behavior, acting on the spur of the moment, doing irrational things without necessarily thinking them through. So someone will typically act on the spur of the moment in response to something without any plan or consideration of the outcome. They may have difficulty following through with plans. There is a real sense of urgency when somebody is impulsive who struggles with these issues. That's why it's very common also for someone with these tendencies to have some self-harming and self-sabotaging behaviors, especially when they're under extreme amount of stress. So risk-taking behavior is another criteria for borderline personality, and it's common for individuals to engage in dangerous, even risky, self-damaging activities, and really without regard to the consequences, and really the lack of, there really is a lack of concern for the limitations of what their capabilities are, as well as just an outright denial of the level of danger that might be involved with those risk-taking behaviors. So some common behaviors might include drug use, self-harm, eating disorders. Things like that are very common for someone who may struggle with a diagnosis of borderline. Another criteria for borderline personality is a history of irritability and hostility, maybe persistent angry feelings or anger that, lashing out at people, and even in response to minor insults. Something that they're very sensitive to may cause them to lash out. So maybe someone could lash out because they didn't say hello to them, and in that moment it might be the end of the world, and they may feel very injured by that and angry and lash out at that person. Now, that doesn't mean that they're going to be aggressive. I'm referring to anger and irritability. So lashing out and saying things in the heat of the moment that are hurtful. And I do want to differentiate that from physical violence. Physical violence doesn't fit in this category. I'm talking more about hostile, angry behavior, but not violence. Violence is not a criteria for a diagnosis of borderline personality. With this diagnosis, these behaviors that we just described need to be relatively stable across time over their history. Also, these impairments or behaviors aren't better described differently. So they're not better described as this is something that is socially acceptable. And this is a behavior that is something that is a behavior that is outside the cultural norms. So if it's a behavior that is maybe more generally accepted within that person's culture or environment, that would exclude these criteria. Another factor that needs to be considered is looking at substance abuse or other medical or physiological factors. Are these issues the direct effect of behavior, or are they something that might be substance abuse related? So if someone is abusing substances, really you can't give them a diagnosis yet of borderline personality until they are clean and sober and free from those drugs. And that's how you get a better baseline of what their true level of functioning is. So when someone is under the influence, it's not an accurate representation of their actual behavior. So as I said earlier, individuals who struggle with borderline personality do struggle with that unstable self-image and lots of internal self-criticism, feeling of emptiness, and really struggle with a lot of self-directedness. So goals are very difficult for this person, being able to follow through with those things and follow through with what their values are and maybe even career plans. Some other issues that need to be considered when someone is struggling with issues of borderline personality are problems with their interpersonal functioning and their relationships. So empathy can be an issue. So individuals with borderline personality do have empathy. However, it can be compromised in relationships, especially when they feel maybe slighted or insulted. That's when a lot of the impulsive behavior comes out, and there's less empathy that is demonstrated in those situations. So they're capable of it, but it's compromised when the relationship becomes more unstable. Individuals with borderline personality also struggle with problems related to intimacy. So there's a lot of extremes in the situation where their relationships are really, really idealized, as in this person is the greatest person in the world, they're my soulmate, etc., etc. And it could flip very, very quickly to the other side, as in this person is the worst person in the world, they're evil, I should have known it all along, so on and so on. So some other personality traits include, like I said, some emotional lability, lots of flip-flopping, frequent mood change, lots of flip-flopping with emotional experiences, mood changes, and someone may describe their mood as being all over the place, they can't control it, and lots of highs and lows. Interesting fact, a lot of people with this diagnosis often get misdiagnosed with bipolar disorder because of the highs and lows. But when someone is explaining their mood and they're explaining that all of these things happen within a day or sometimes a couple hours, typically that's more personality related than bipolar related. A lot of people with borderline personality also struggle with intense anxiety, and part of it is, the emotional lability, the mood instability. It is really difficult to manage their mood. There's a lot of apprehension and fear of uncertainty, feeling out of control and fear of losing control. People struggle with a very intense fear of being abandoned, or even just the feeling of it is very, very uncomfortable and can lead to all of those emotions that we were just talking about. And so when someone with these issues really senses that maybe they might, there's this fear of abandonment, all of these emotions flood in and just snowball. There's a pattern of intense and unstable relationships that goes across time. So not just one relationship, but many relationships that start out being idealized and then eventually flip and do a 180. There might be some identity disturbances, that unstable self, our sense of self and self-image. There's some impulsive behavior, at least in a couple of areas. Sometimes it's with spending, can be with sex, substance abuse, reckless behavior, binge eating disorders, self-harm. There might be some recurrent suicidal gestures or behaviors. And sometimes individuals who struggle with this might use that as a tactic to avoid fear of being abandoned, that if you leave, I'm going to kill myself or I'm going to hurt myself. So if you are someone who might be struggling with some of these symptoms, I want you to know that there is help out there for you, and there's so much research that has been done on borderline personality that is extremely promising. The gold standard of treatment for working with someone with borderline personality is something called DBT, and that stands for Dialectical Behavioral Therapy. With DBT, there are 4 components to this treatment, and they include mindfulness, interpersonal communication, emotion regulation, and distress tolerance. And these are skills that actually everybody can benefit from, but what DBT does is just reorders them in a way that makes sense and makes them more accessible so that they can be better used as coping skills. In my time as a clinician, I've seen DBT be very useful and very effective. I would have to say I've worked with hundreds of individuals who struggle with these very tendencies, and there's so much hope out there for people to improve. So don't give up hope. If you are someone who's struggling with these symptoms, I would highly encourage you to seek out a therapist and get some support, and also maybe get more clarity on what might be going on so that you could get the help that you need. In my work as a therapist, I never want to be reckless and jump to conclusions about diagnoses at all. So it's always best to, get the support you need, and once you have that clarity, at least then you'll know what direction you need to go in terms of treatment. Another resource that I would recommend is seeking out a psychiatrist. With medication, since this is not my area of expertise, I want to defer that to the psychiatrist, but I can tell you that there are medications out there that can help manage some of the mood swings and also manage some of the symptoms of depression. As far as I know, there isn't a medication that will cure someone of their diagnosis of borderline, but there are medications that will help manage those symptoms that are associated with it. When your moods are feeling really extreme and you're at the height of things and you feel like giving up, know that those symptoms and those feelings, those thoughts always change, and they will always change. And that can be really helpful to know, because sometimes it's really hard to think of maybe a coping skill in the middle of that, and you feel like you're at your wit's end. But just knowing that will go away, and remind yourself that this feeling is temporary, can be one of the greatest things to remember, because things always get better, and they always will. And know that if you are someone who's struggling with these symptoms, that there is help out there for you, and that you are worth it. So that's it for today's video. I hope you found this information useful and helpful. Don't forget to like and subscribe below. And if you'd like to see some of my other content, please check out my other videos and at my blog, the selfconfidencechronicles.com. I'm Dr. Christy, and I will see you next time. Bye.